Hello doctors. Today we are going to insert RYLE'S tube. This is the demonstration video for RYLE'S tube insertion. So what are the indications for RYLE'S tube insertion? RYLE'S tube mainly, we insert RYLE'S tube mainly for feeding purpose in esophageal or any type of malignancy to feed the patient. And we use RYLE'S tube for the gastric lavage in poisoning cases except the kerosene poisoning because there is a risk of rupture of stomach. And we also use RYLE'S tube to decompress the stomach like in obstruction cases, and we put it before the any planned surgery to inhibit the aspiration. So these are the indications for RYLE'S tube insertion. And contraindication for RYLE'S tube, nasal trauma, any history of nasal trauma, and head injury, frontal bone fracture. In these conditions we avoid RYLE'S tube. So now what are the things we need to put a RYLE'S tube? First of all, this is a RYLE'S tube made of silicone or PVC, and this is a xylocaine jelly. All things we need for RYLE'S tube insertion. This is a syringe. I will tell you about what is the use of this thing here, and a drainage bag. So these are the things which are needed to put a RYLE'S tube. So here is the RYLE'S tube. From this end we are going to put this in the nose of patient, and this is a drainage. Here we connect the drainage bag. So here are some markings and openings in RYLE'S tube. These are the openings. There are multiple openings in case one opening obstruct so that other can drain the content. And there is a line, blue color line, going from here to the end of RYLE'S tube. This is the radio opaque line, and it is used to identify the or confirm the site of RYLE'S tube. After we put the RYLE'S tube, this line will be seen as a opaque white line on X-ray, which will tell you about the correct position of the RYLE'S tube after the insertion. And there are some markings you can see. These are the markings, number wise marking: 50 centimeter, 60 centimeter, 70 centimeter. These are markings for the part, respective part. Like if we have to put in stomach like 50 centimeter, then duodenum 60 centimeter, and then further for 70 centimeter. So these are the part of a RYLE'S tube. So we are going to put lidocaine jelly or xylocaine jelly 2% on other hand like this, and then we are going to make this end smooth. The correct position of putting the RYLE'S tube in a patient is sitting position, and there will be flexion of neck. Sitting, and there will be flexion of neck to put the RYLE'S tube. This is the ideal position. But for here, for our comfort and patient comfort, the patient lying down, and we will going to put this inside the anterior nares of patient along the floor of nose. So this RYLE'S tube we will going to put along the floor of nose. So to measure the exact site, there is measurement. We will measure it from the tip of nose of patient to tragus or ear, anterior side of ear, and then we measure it up to Ziphis sternum. So this is the correct marking, up to 60 centimeters. So this is the method of measurement of length which we are going to put inside the patient abdomen. So here we are going to start the procedure. First of all, put the lignocaine jelly, and now we will going to put. So this part of RYLE'S tube will obviously hit the pharynx part. So to inhibit the gag reflex, we are going to instruct the patient to swallow. When we going to pass the tube inside the pharynx, we ask the patient to swallow to inhibit the gag reflex. So we are instructing the patient. जब ये अंदर जाएगी ना, पीछे से उल्टी नहीं करनी, निगलना है इसको, ठीक है? निगलना है, उल्टी का मन हुए तो निगलना है आराम से, ठीक है? ठीक है. So with little flexion at neck. So we are going from the right nostril along the floor. Along the floor we are going patient to swallow. निगल भाई, निगल, बहुत अच्छे निगल, आराम से निगल, अंदर निगल, निकलो इसको, निकलो आराम से निकलो, निकलो अंदर निकलो। बहुत बढ़िया, बहुत बढ़िया, बहुत बढ़िया। निकल ले अंदर, निकल ले। बहुत अच्छे, बहुत बढ़िया। निकल लो, निकल लो, निकल लो, निकल लो। So up to 60 centimeter, as mentioned, we put the tube, and here you can see there is content, salivary content in the tube. So it can be a confirmation that we have put the tube in the esophagus and then to stomach, not in trachea. So to confirm the site, we can aspirate with this 10 ml syringe. So we can aspirate here. So here you can see that there is a clear stomach content, yellow colored, yellow tinged fluid. So it confirms our finding that the tube is in right place. So here you can see the green fluid. It can be bile because of obstruction. The patient has history of not passing stool and vomiting for last 3 days. So to decompress the bowel, we are going to put, this is the indication of putting RYLE'S tube in this patient. Another method to confirm the site, so there are two methods of confirmation of, for site confirmation. First I have told that we can aspirate the fluid, and another method is by pushing the air in this RYLE'S tube. We can hear a gurgling sound at the epigastrium region with the help of stethoscope. So rapid push and we hear a sound at epigastrium, so we will confirm the site of RYLE'S tube with the help of auscultation. So there are simple two methods, one aspiration of contents and other is by pushing the air into the RYLE'S tube. So this is the all about the RYLE'S tube insertion. So the last step is the fixation of RYLE'S tube. So with the help of dynoplast, we are going to fix this tube to secure the RYLE'S tube. So by this method, this is the non-invasive method of fixing the tube. We are going to fix this tube with the help of dynoplast only. So here we put dynoplast like this, and we will put another drainage bag here in this part. So this is the all about the RYLE'S tube insertion. I hope you have a clear understanding of this procedure and you will try in boards. So thanks for watching, and if you have any query, let me know us in the comment section. Thank you.